Let me introduce Dr. Deepak Sachdeva. So, welcome to our session on yoga for therapy. Basically, this session focuses on diabetes management. We will also be having future sessions on different topics which will be communicated in due course. So let me start with myself. I'm Siraj from Mahasangh, and we organize these events on a regular basis. So keep an eye out. They will normally be on Sundays. So let me start by introducing Dr. Deepak Sachdeva, who has a practice in New Delhi. Dr. Deepak Sachdeva's skills in human body biomechanics are exceptional. His understanding of the body muscles, bones, joints, movements, their pathology, and the restoration with medical yoga techniques is unique. His education and training make him an expert on the human body movements. His education includes Anatomy X, musculoskeletal study cases from Harvard University, bachelor's in physical education, diploma in yoga education, PGD therapeutic restorative yoga in 2005, followed by MPhil and then PhD in yoga in 2012. His 15 years of exceptional work in the field of yoga therapy for pain relief has brought him numerous acknowledgements and awards, including one from the President of India. So, at this point, I would like to hand over to Dr. Sachdeva.
Diabetes and controlling diabetes. Diabetes is one of the most prevalent problems in the society today. And the other one is high blood pressure. Both of these problems come actually hand in hand. But diabetes is something that is partially under your control. You can actually treat diabetes, control it, and live a normal life. What I strongly believe is that we are meant to live for 100 years, at least for 100 years. So a human life can be easily extended from anything between 100 to 110 years. And I personally feel that I'm going to live for 110 years. And because of some mistakes which people do, the lifespan starts reducing. And some of those mistakes are by ignorance, and some of those are by choice also. Now, the mistakes which are by choice and which are which we are used to do, those problems usually cause long-term problems, long-term disorders, and also they lead to lower back pain, neck pain, arthritis, indigestion, and various other ailments. And diabetes is also partially linked to that. Now, when I talk about diabetes, and it means that the blood sugar levels, what are the common questions which people have about diabetes? What is diabetes? Diabetes is basically a change of metabolism between the fat, carbohydrates, and proteins in the body. I'll not get into too much of the technical details of it. What are the types of diabetes? Type 1 and type 2 are the most commonly known diabetes. Type 1 is the diabetes which usually occurs in very young people, and type 2 occurs in relatively middle age or later age. And the type 1 diabetes is the diabetes in which the insulin producing cells are dead, and type 2 diabetes is the one in which the insulin producing cells are exhausted, not completely dead. And they are overloaded, they are working hard to meet the requirements. So in first case, the pancreas, the insulin producing beta cells are not there. In second case, they are partially there. So type 2 diabetes is the one which we are going to focus on today, and type 2 diabetes is the main problem what the population is facing these days. What are the normal blood sugar levels? In India, we consider 100 to 110 as fasting. and 140 to 150 as PP. Sugar levels are normal. In other standards, in Australian standards, we consider 6 and 8 as 110 and 150 in India. So approximately the sugar levels should be somewhere around 6.1 when you test the fasting sugar levels, and something around 8 when we talk about the normal PP levels, means after your meals, after 2 hours of your meals. So we call them blood sugar levels. Next question which normally people ask is it curable? Diabetes is definitely controllable. It is manageable, easily manageable. Is it curable? Yes, there are studies which are now showing us that diabetes is actually curable. The study says that it may take 5 years time to cure diabetes if you follow a certain lifestyle, if you follow certain do's and don'ts in lifestyle. So it is curable, and there are studies about it. So now I'll just quickly show you some of the results which you can expect from the postures that you're going to learn today. So there is a case here. So 𝗵𝐴1C test is the test which shows 3 months average of your blood sugar levels. So this person, 𝗵𝗵𝗃𝗃 was his name. His blood sugar levels were 14.3, which is alarmingly high, dangerously high. So ideally the results should be something under 7. And after 6 months of practicing the postures which I'm going to teach you today, the results are 7.6. So from 14.3 to 7.6 in 6 months of time, he was taking all the medicines which were prescribed to him. And apart from those medicine, he added the do's and don'ts which were told to him in the medical yoga session. So I'll be sharing many of those inputs which I shared with Pankaj, and I'll be sharing those inputs with you in today's session. So the first and the foremost thing, the most important thing to start with, there are 3 pillars of health. A lot of you would think that if I'll take this medicine, diabetes will come under control. If I'll follow good exercise, diabetes will come under control. If I stay relaxed, if I do not have any stress, diabetes will come under control. So it is not one factor that controls diabetes. There are 3 pillars of health. 3 pillars of health: Aahar, Vihar, and Vichar. So diet, physical activities, and thoughts. Unless you control all the 3, diabetes will never come under control. It's not just about diabetes. It's about wellness. It's about health. It's about your strength. It's about your well-being. Your well-being depends on these 3 pillars: Aahar, Vihar, Vichar. Aahar is the diet that you take. Vihar means the physical activities, including rest. Including rest. We'll talk on all these 3 aspects in detail in the presentation coming forward. Next is the Vichar, the thoughts. So in today's session, the next 1 hour of this session, we will be mainly focused on the aspect of Vihar, your activities. And that is what people expect when we talk about a yoga session. A lot of you are ready with the yoga mats and are looking forward to learn some yoga postures which will help you to control diabetes. So we are going towards that. We will learn those yoga postures which control diabetes effectively and quickly. But before knowing that, you must also understand that it is not only the yoga postures which are going to help you. You have to follow all the 3 steps to control diabetes completely. So the first thing is the diet. Second is the activities, which includes yoga. So yoga is one of the activities that you have to follow. And the thoughts. the vichar aspect of it, right? So I'll take you forward in this philosophy to understand what is yoga. What do you understand when I ask you what's yoga? Yoga means to unite. Unite anything. Anything. If you unite, it's yoga. Yoga means the union. Jod, jama karna. So unite. Yoga. Now, what are the things that you should be focusing on when you talk about yoga? And those things are the subject of your choice. So who is a yogi? Anyone who is united with his subject is a yogi. So can you type a few names in the chat box of the yogis you know? Who are the yogis you already know in the real world? Can you type some of those names? So let me just yes, so I can see some responses here. Baba Ramdev ji, yes. Swami Vivekanand ji, yes. Iyengar Guru ji, yes. Swami Paramhans, Swami Vivekanand, Sadguru, all of these are well-known yogis. Well-known means the popular yogis, you all know. And this also gives you an indication that you only think of yoga with somebody who talks about spirituality. You have not written the name of Warren Buffett here. It should be there in the list. You have not written the name of Amitabh Bachchan in this list. I want that name to be there in the list. Yogi is the one who is united with his subject. The subject can be any as per his choice. So if you are united with spirituality, you are thriving for something. You achieve that. You get the gyan and you then start distributing it to the public. That is what your union is with. And if that union is with, let's say, let's talk about Amitabh Bachchan, and his union is with acting. So the yogis you normally refer to are the ones which you can see here on the screen. But these are also yogis which you are now seeing at your screen. Bill Gates, definite yogi. Obama, a definite yogi. Bruce Lee, David Beckham. Anybody who is on the top of his field is a yogi. Because you only reach to the top when you're focused, when you're one with your idea. Only then you reach the top of your field, of any subject of your choice. So focus is what is needed. So Amitabh Bachchan focuses on improving his voice, his body language, his delivery of dialogues. So his focus, his yoga is with acting. Bill Gates focused on coding. Bruce Lee focused on his moves. Obama, David Beckham, all of these are yogis because they are focused in their approach. They are one with the subject of their choice. Amitabh Bachchan was rejected to become an army officer. He was rejected in the SSB interview. He said, army said, no, we don't want you. And Dr. Abdul Kalam was also rejected from the SSB interview. They said, no, you're not fit for the army. But he was fit for something else. So his focus, when he brought to something of his choice, be it nuclear energy or be it acting, and you become one, then you grow. So anybody who is on the top of their fields are yogis. So you can also pick up a subject of your choice and do yoga asanas and practice of meditation and excel in your field. You want to become a good mathematician, do yoga postures, do meditation, and see how you quickly excel in the field of mathematics. You can apply this science to any field of your choice. Any field of your choice. So, to become a yogi, yoga postures is a tool. Yoga asanas is a tool. Meditation is a tool to improve your focus on X, Y, or Z, any subject of your choice. So, if you want to control diabetes, if you want to become healthy, if you want to become fit, your focus has to be there. The moment you bring your focus there, your actions will be aligned to your focus. And your actions will bring the sugar levels down. Your actions will improve your health. Your actions, if they are aligned to improve your business is bound to improve. Your relationships are bound to improve. So anything you will bring your focus on will start growing. And that is how you have been living your life so far. Wherever you have been focusing on has been achieved. So, most important thing is to listen and respond to the signals of your body. If you listen and respond to the signals of your body, you will not have most of the problems, or I would rather say any problem in your life. And when I talk about this, I talk about lower back pain, neck pain, knee pain, digestive disorders, because all of them come in because you're not listening and responding to the signals of your body. So when I say listen and respond, it means I give you an easier example first, and then I'll come to diabetes for an example. So the first example is of the neck pain and lower back pain. When you're working on your laptop, when you're working on your workstation, and your back says, I'm tired. Can I take a break? Your neck says, give me a break. We need to, do some movements. You say, no. I have to finish this work by 8 o'clock tonight. If I don't do this, my boss will. So you ignore the signals of your body, and you'll end up with cervical spondylitis after maybe 6 months or 1 year, or lower back pain, because you're not listening and responding. Probably you're listening, but you're not responding to the signals of your body. So listen and respond to the signals of your body. When it comes to diabetes, what you need to listen to your body is, your body is asking for rest. If you don't take proper rest, the blood sugar levels may go up. If your stomach is full, do not overeat. Just because the next chapati is ready, your wife has already made a chapati, and she says, take one more, or take a bit of, a bit of sweets, or take a bit of this or that, even when you're full, means you're not responding to the signals of your body. Your body is saying that I'm full, I don't need any more food, but you still have it because of social pressures or whatever reason you're having it, because of the pressure of the person who is standing next to you, or just because of the taste, because you're under your own pressure. You can't avoid a jalebi after your meals. So if you listen and respond to the signals of your body, you will not have the troubles, and the blood sugar levels will definitely start coming under control. So what you need to do, focus in diabetes, is 3 things again. Diabetes is a 3-leg chair. So you have to control all these 3 things to control it. One is the diet. Second is the physical activities. Third is the thought. Aahar, Vihar, and Vichar. If any one of the 3 is not in line, you are bound to fall, for sure. Now, when I talk about Aahar, it means correct diet for a healthy digestive system. That's it. So eat on time. Time is very, very, very important when it comes to diet. Your body produces digestive juices. Let's say you have your lunch at 2 o'clock, for example. So your body is ready with the digestive juices at 2 o'clock. And you skip your lunch, or you have your lunch, let's say, at 4 o'clock that day. So the digestive juice is not there at 4 o'clock in the stomach. When you will have your when you will have your lunch at 4 o'clock, the food will not be emulsified properly. The food will not be broken down properly into smaller particles. So there will be bigger food molecules, bigger food particles left in the stomach and intestine, undigested or partially digested, which will lead to bloating, gas, acidity, and ultimately we label it as indigestion. And as per Ayurveda, diabetes starts from the stomach. It starts from indigestion. Even if it is there in the genes, even if it is hereditary, it will come earlier if your digestion is poor. So having good digestion is absolutely essential to control diabetes. Even if you have to take 𝗃𝗶𝗃𝗃 or 𝗕𝗵 or any other supplement to regulate your digestive system, take it. First thing is to eat on time, eat the right food, eat the right diet. Even after that, if you have the problem of indigestion, do take some supplements to help your intestine to maintain a healthy digestion. You may take 𝗃𝗶𝗃𝗃 or 𝗕𝗏 or whatever that suits your body to aid digestion. No constipation, no indigestion is allowed in case of diabetes. Now, one very important thing which we usually miss is a toothpaste. A toothpaste has to be changed every month or at least every time when you buy a new one. The germs, the bacteria in the mouth, they become used to the same brand that you are using. Let's say you are using Colgate from 2 years. The bacteria in the mouth will become resistant to that particular brand. You have heard about the concept of if you take too many painkillers, your body will not respond to it after some time. If you keep taking a particular medicine, your body will become immune to it and your body will not respond to it. What is that? The cells learn how to avoid that particular medicine that is being given. So the germs modify themselves to that particular toothpaste that you're using from years and years together. So change the toothpaste every month so the germs do not get used to that one particular brand, and every time if you'll change it, the germs will be swept away and your buccal cavity, your oral cavity will be healthy. And why it is important to keep your oral cavity healthy? Because it causes indigestion if you have germs in your mouth. Your stomach will, so let's say there is a bacteria sitting between the teeth. Your body will sense it as a food. Your body will sense that something is about to come in the stomach and it will start producing digestive juice. And that bacteria never comes to the stomach. It just remains there for 24 hours. So your digestive system is always working on something that is never going to come in the stomach. It is overactive. So the stomach is overactive. It is producing unnecessary juices to digest something which is not going to come, which is not coming into the stomach. So to eradicate this problem, the simple solution is to change your toothpaste and massage your gums every time whenever you can. Means after you're done with your brushing, simply with a finger, if you can massage the gums, it's a healthy habit. Do it. And if possible, use some sarso oil and clove and massages on the gums if you can. It is a healthy habit and it improves the sugar levels, right? So I'll not get into too many of such tips because the focus of today's session is the vihar, the asanas that you probably all are waiting for. And I'll quickly cover some tips for you in one slide. Otherwise, I can give 5 slides to these 5 topics, but quickly, I'm covering them in one slide. So 1 bowl salad every day is a must. You can have this salad anytime till 4 o'clock. So you can have salad in the breakfast. You can have it at 11 o'clock. You can have it before your lunch time. You can have it at 4 o'clock approx when you are again feeling hungry after your lunch is done. So having a bowl of salad. A bowl means a bowl, not a small bowl, a full bowl. That should have at least 2 full veggies in it. So when I talk about bowl, it means a bowl like this, a bigger bowl. So second thing is 𝗃𝗏. 𝗃𝗏 is a natural herb. You can try looking for it online, and you can get some powder of 𝗃𝗏 for yourself, or you can also find some capsules or tablets of 𝗃𝗏. So 𝗃𝗏 is a natural herb which is an excellent immunity booster, energy booster, and it controls diabetes. It is also good for reproductive organs. It is also good for kidneys. It is also good for some cardiac conditions as well. It is also good for prostate and other conditions in males, as well as some reproductive organ related conditions in females. So 𝗃𝗏 is something that you can look for online and see if it is an OTC thing over the counter. If you can purchase it, you can consider consuming 𝗃𝗏. A2 cow's ghee. So A2 ghee or A2 milk is available in Australia very easily. Invest on it. Buy only A2 milk. Develop the taste of A2 milk. Only consume A2 milk. And if you can make ghee at your home from that A2 milk, that is the best thing you can do for your body. It is mentioned in Ayurveda that you should eat A2 ghee regularly. It is good for the nervous system, good for digestive system, good for your stomach, good for intestine, good for knee joint, good for lower back, good for skin, good for eyes. It has endless benefits, and that is why Ayurveda says even if you have to borrow money to eat ghee, borrow money. So it is mentioned in the text. So much importance is given to desi ghee. So eat. When we talk about desi ghee, we are not talking about buffalo's ghee. We are not talking about cow's ghee. We are talking about desi cow's ghee. That is A2 milk, A2 ghee, which can be easily made from your A2 milk, which is available easily in Australia. And whenever you buy, you don't buy the regular milk, buy A2 milk. Times of meal. I've already emphasized on this point, so I'll not give any more time to this particular subject. Fix a time of your meals and have your meals at that particular time every day. Even if you are traveling, even if you are in your office, or even if you are stuck somewhere where you can't have your full meals, keep something in your pocket which you can simply munch at that time. Maybe simple bhune hue chane can help you, or roasted peanuts, or anything you can carry with yourself, or a fruit, or something that you can eat. So, but maintain the time of your meals. And the last point in your diet, and then we'll move on to the next part of this webinar. Lot of leaves. Hindi mein to patte khane hai. This is something very important, and if you'll do it, sugar levels will come under control quickly, and it will remain under control for a long time. When I talk about eating leaves, It means you can simply make a vegetable juice which involves a lot of leaves and drink the juice in the morning. So simple green vegetable juice is what I'm talking about when I talk about eating leaves. When I talk about a lot of leaves, it means green vegetable juice. I'll share a recipe of green vegetable juice. I'll share it. I'll share it with the organizers of this event, and they'll share it with you, and then you can you can start following that recipe, or alternatively, just give me a second and I do it right away. Just 1 second, please. And I'm sharing this link in the chat box of a Google form. Yes. So I've shared a link of a Google form here in the chat. You can use this link and share your details, and we'll send this this recipe to you on your email, and a lot of other stuff that I want to send you at the end of this presentation will be sent to those who will fill this form, or I'll share some of them with the organizers, and they can also share it with you. Right. So a lot of leaves are needed. So green vegetable juice is very good. You need not put karela or neem into it. Just make it healthy, tasty, something that you can relish, something that you can continue for months and years together. So a green vegetable juice is not only good for diabetics, it is very, 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 very good for general immunity boosting. It is very good for cleansing the intestine. It is very good for cardiac conditions. It is very good for controlling blood pressure. It is very good for improving the luster of the skin. It is very good for detoxification of the body. So a green vegetable juice is a must to follow. It is as important as the desi cow's ghee is. So from this topic, now we are moving on to the next aspect of it. Something that you all have joined this webinar mainly for. The medical yoga asanas is the part of this chapter of this webinar. Second thing that I want to talk about is the full sleep, and the third part is walk. So vihar. So we have talked about ahar, that chapter is done. Now we are talking about vihar, then the third chapter is going to be on vichar, means the thoughts. So vihar, activities. So in your activities, you should be focused on the three aspects again. You must go for a walk every day and in the open. Some people think that we'll only walk inside the house. No, we'll walk in the rooms, in the garage, or in the lobby. No, go outside, walk in the parks, walk in the walk in the parks. Actually walk in the parks, not even on the roadsides. If you do not have a park nearby, then you can still go out and walk on the side of the road. But walking in the park connects your energy to the universe. It connects you directly to the universe, and you receive the strength and the power from the universe. So walking in open will give you a lot of energy, a lot of strength, a lot of positivity. And that is all you need to fight back any medical ailment. So walking in the park in open areas is very good. Do take care of social distancing, but go out for the walks and try to do it on a grass, on a natural surface, something that you can relax and you can enjoy. Right? And walking should not be something sandwiched between your tightly packed schedule. Oh, I have to go for a walk. I'll do this later, and I'll quickly go out and do this walking first. And walking is for relaxation. Walking is for mental peace. Walking will give you the best effects if you do it in a relaxed way. So when you're walking in a park, you can put on your earphones and play some bhajan, play some music, play some talks, and then do the walk. Not on the mobile phone. not with somebody who is discussing BJP and Congress with you. No, relax. Walk is for relaxation. So walking is definitely important. Full sleep is a part of activity. Why sleep is categorized as a part of activity? Because not doing an activity is also an activity. People don't know how to relax. People don't know how to let go things. So they want to do a lot of things in limited time, and the sleep is usually compromised because of that. A full sleep is a must. A full sleep is a must. If you are, let's say, 35-40 years of your age, sleeping from 8 to 10 hours is absolutely essential. It will improve your memory, it will improve your cardiac health, it will improve your kidneys health, it will control diabetes. If you are, let's say, somewhere around 60-65 years of age, or something between 35-40 to 60-65, then your sleep should be 7 to 9 hours. And if you are above 65, your sleep should be somewhere between 6.5 to 8.5 hours. So your sleep has to be, given due attention. There is a subject called sleep hygiene. We can do a full webinar on sleep hygiene. How to have a good sleep, how to get a sleep that truly relaxes you. So that is a big subject, but you can go online and study sleep hygiene. Sleep hygiene. Right. And the third part of the webinar, of this aspect, Vihar, the activities. So we are going to learn 2 yoga postures now. And there is a sequence of 5 yoga postures that we usually teach to diabetics. But when it comes to a webinar, when it comes to an online training session, and that too to a group, you have to go safe. So we'll be learning 2 postures which almost everybody can learn and practice, and the remaining 3 postures, the 5 postures, there are 5 postures in the sequence, we'll be learning 2. The remaining 3 postures are also important, but they are more technical and they involve more precision, and they are also demanding for the neck and lower back. So we'll be focusing on the remaining 2 postures, which are easy to do, effective, and there is no pressure on the neck or lower back or any other body part. So anybody more or less can learn these 2 asanas and then practice at their own. So I'll request my assistant here, my team member here, Anamika, to demonstrate one posture, which is Merudandasan. And this posture is done on a chair with a bolster. One chair and a bolster is what you need for this asana. So Anamika, please come. I'll just quickly introduce you to the public here. So this is Anamika. Anamika will demonstrate Merudandasan to you now. So Anamika, please take a chair and a bolster, and we'll do it in the yoga hall. So I'll take the camera to Anamika now, and I'll try to show this posture to you from all the angles. This posture is to be done for 1 minute from right side and 1 minute from left side in 1 repetition, and then you have to practice it 3 times each side, 3 times left, 3 times right. And to do this posture, you should have had your meals at least 1.5 hours before doing this asana. And this asana can be done even in your office, can be done anywhere where you have a good sitting arrangement. So I'll quickly take you to another channel to teach you the posture. So take a chair. So it's a yoga chair. So it's a simple yoga chair. You can all see. So yes, this sounds very good. So Namika, please have your seat here. So you have to sit on a chair facing on one side. So this is the back of the chair. So Namika is keeping her leg on the left side of the chair. Then you have to hold a bolster between your knees. So this is a cotton bolster, a simple bolster, a pillow, a round pillow, a cushion. This has to be held between the knee joints. Initially, you can place it on the floor, but after a few days of practice, you should hold the bolster between your knees in the air, so it is up from the ground, from the floor. Now, what you're supposed to do is to breathe in, breathe out, and turn towards the back of the chair. So you can simply hold the chair, breathe in, breathe out, and turn from the left. Breathe in again, breathe out, and turn from the chest this time. Breathe in, breathe out, and turn from the neck and shoulders this time.
Doctor, please share the slide. I can't see your video.
I ask you to do so. I have only demonstrated it to you. If you go into the posture and you turn your neck away, you will not know how to come back from the posture. So wait till I explain to you how to come out of it. I ask all of you to do it, and I monitor this posture from here. But you just learn the technique. So once you reach in the posture,
Doctor,
breathe long.
Doctor, we can't see. Please unshare the slide. Sorry, please unshare the slide. We can't see your video demonstration.
Okay. So, share.
We are able to see.
Able to see the
Not
posture?
everybody can see. No, not everybody can see.
All right.
Maybe you need to click on the doctor picture and then you can, the picture will zoom it.
So people who
body has to be
can't click Zoom.
Okay. So if you may want to give it a full screen,
That's better. That is better. Thank you.
all right. So I just explain it to you once again. Please come back. I'll explain this thing to you once again. So this is a cotton bolster, a thick cotton bolster. This has to be held between the knee joints. Initially, when you are doing it, you should keep the bolster on the floor and just hold it from your knees. And after a few days of practice, I want you to hold the bolster in the little higher from the floor, like she's holding it now. All right. So Anamika, please keep it on the floor now. Yes. So this is what we want to show you at the moment. So sit tall, sit straight, sit anti-gravity up, keep your spine pulled up. Breathe in and breathe out and turn towards the left side of the body, so towards the back of the chair. Breathe in, breathe out, and turn from the chest further towards the back of the chair. Breathe in, breathe out, and turn from the shoulders and neck towards the back of the chair. So you've done 3 turns towards the back of the chair. One from the abdomen, second from the chest, third from the neck and shoulders. Face that side. Maintain this position for 1 minute. Breathe normally. Normal breathing. Let's say you have done it for a minute. Now, you come back. Slowly turn your neck and shoulders first. Then come back to the chest. Then come back to the back. So you have done this twisting on the left side. So I ask Anamika to turn the chair. I will not ask her to turn that side. I'll ask her to turn the chair. So now she is doing on the other side. So again, what is the posture means? You are still not doing the posture. I'm only demonstrating it to you. Sit tall, sit gently, gravity up, pull your spine up. Breathe in and breathe out and turn from your abdomen to the right side. So can you see the wrinkles on her abdomen? Can you see the wrinkles on her t-shirt now? That means she has done correct twisting from the abdomen. Breathe in and breathe out and turn from the chest. Breathe in and breathe out and turn from the neck and shoulders. So, breathe normally. Do it for a minute, and then you have to slowly come back. Now, assuming that she has done it for a minute, so she slowly turn her face and shoulders first. Then chest back, then abdomen. And this posture has to be repeated 3 times on this side. Alright. So now I'll ask those who want to do this posture.
Doctor,
Yes, Sirajit.
your voice was not clear, so can we improve that a little bit with a headphone or something?
Okay, so that was the yoga hall. So probably the signal was a little weak there.
Okay.
So the voice might have cracked there, but so you want me to give you the instructions once again?
No, better now.
All right. So those who want to do this posture, they may do it now, and I'm watching you. So you have to switch on your video. Those who are doing this posture now, please switch on your video, and then I'll check whether your posture is correct or not. I'll also send you a video of this asana so you can actually practice it by looking at it multiple times.
Doctor, quick question. If you don't have a cotton bolster, can you just use sort of a pillow or something like that? Does it have to be a certain weight or anything in particular?
All right. So anything that you want, anything is okay to keep your knees together. You can simply hold a cushion, any cushion, even the cushion that you use on the sofas. You can keep that cushion also between your knees. That is also okay. All right. So I'll now demonstrate the second posture to you, which is Viprit Karani with wall. So I'll again ask Anamika to come and do this posture and demonstrate it to you. This asana is very good for relaxation, and it reduces the stress level instantly. So I'll ask Anamika to demonstrate that posture on one of the yoga benches here. So Siraji, let me know if the voice cracks.
Okay, no problem. I will do that. Sorry, it has paused a little bit now. The signal has paused.
Different location. All right. So Just this is a bench, a yoga bench. It is just like your bed, the one you use at home, right? So you have to sit closer to the wall to do this. You can do it on the floor also. You can do it on the bed also. So you have to sit closer to the wall and then slowly lie down and your legs going up on the wall. It is very simple and easy. That's it. Just keep your legs up on the wall. That's it. Keep your legs straight. That's it. That's it. You don't have to go very closer to the wall. I want you to stay away from the wall. Yes. That's it. Thank you. So if you're away from the wall, it is easier to do this posture. That's it. It is very simple. And it relaxes your, it gives relaxation and soothing effect on the sympathetic nervous system. So your body relaxes and the blood sugar levels start to come down. And this posture is also very easy. I would recommend to keep a support under your head, especially if you have a blood pressure problem, if you have high blood pressure. So I'll ask Monica to simply keep a fold of this mattress under her head. So I've folded the mattress itself. So because it is like a cushion under the head. So this will support the leg and head. Now this posture has to be done for 10 minutes. In this posture, a lot of people feel sleepy because the blood circulation improves towards the abdomen, chest, and brain. So you tend to fall asleep. So it is also very good for those who have sleep disorders, who find it difficult to go to sleep. This posture is also very good for those who have high stress levels, because it relaxes the mind. This posture is also good for travelers, because after traveling, if your legs swell up, if you feel tired, so this posture will remove the swelling from the legs also, and this posture will also improve the energy levels of the body. It is very simple and can be done anywhere. Even when you're traveling in a hotel, you can still do this posture. So, how to come out of this posture? Let's assume that she has done it for 10 minutes. I'm just slowly fold your legs, fold your hands, keep your hands on your body, fold your arms. Slowly turn to the right side. Keep your hands on your head. And rest here for 1 minute. The blood circulation that was increased from legs to abdomen and brain of the head will now have its time to settle down. So resting here is very important. Those who want to sleep, those who want to sleep here, they can simply take a turn and sleep. And if you are feeling you find it difficult to sleep easily, you can do this asana for 15 minutes instead of 10 minutes. And then turn to the right side and sleep. You will find it very, you'll find it that your quality of sleep has improved. Alright, now slowly sit up for a minute. Thank you for this presentation. So these are the two yoga postures.
Hello, doctor.
both of these asanas, and I can send it to the organizers also, and to those who are filling up this form, I can directly send it to them as well. All right, so Vihar part we have just talked about. Now the third thing is, so this is the posture which you just did. You are sitting in a chair, holding a bolster or any cushion between your knees, and then twisting to the side. Okay, so one more benefit I would like to share with you of this asana is you tell me the answer to the question I'm asking you. Where are most of the organs of the body located? Head, torso, arms, or legs?
Torso.
Head, torso, arms, or legs?
Torso.
Yes, torso, correct. Spine, correct. Spine is also in the torso, right? Correct answer. So, see how nature has designed the things. Huh? Lungs are here, heart, liver, spleen, kidneys in the abdomen, bladder in the abdomen, intestine small and large both in the abdomen, bladder in the abdomen, uterus in the abdomen, prostate in the abdomen. Almost all organs are in the torso, are in the chest and abdomen. And there are some vital organs up in the head also, but this is the space where most of the organs are located. So when you do this twisting asana, the Merudandasana, you actually give massage not just to your pancreas, but also to your liver, your gallbladder, your spleen, your intestines. All of them are massaged in one direction and then in the other direction. And we all know the benefits of massage. It improves blood circulation. When you do the massage on the arms, on your neck, on your thighs, you directly see the benefits. But because of the rib cage, because of the pelvic bones here, you cannot do the deep tissue massage here, or you can't, reach deeply to these organs with your hands or your external massage. The only option is twisting postures. There are some other postures as well, but the twisting asanas are the most effective postures when it comes to the massaging of the organs. So the Merudandasana on chair, the one you have just learned, is not only good for controlling diabetes, but it is also very good for general health of your organs. Now, there is a contraindication. There is something that you must understand. When you're doing this asana, your chest must remain open. So when you twist on a side, do not collapse your shoulder, because collapsing a shoulder will increase the pressure on the chest on one side, and it is not considered good for the cardiac patients. So when you do this posture, ensure that your chest is open, and then you're doing the twist. So what we safely say is cardiac patients don't do it. If you are able to maintain the correct posture, almost everybody can do this posture, but it is mainly meant for controlling diabetes and improving the health of all internal organs in the chest and abdomen. So next posture, the one I just demonstrated to you, is this Viparit Karani with wall. Now there is an ECP machine available in the market. And to my understanding, this machine is also now available in Australia for the treatment of cardiac patients. Now, what does this machine does is this machine. This is the ECP machine, in which the cuffs are tied on the legs of a patient. The idea is that the body has 5.5 liters of blood. If you will squeeze the legs with the help of the cuffs, the blood will be pushed towards the abdomen, chest, and the upper parts of the body. So that 5.5 liters of blood, out of which a lot of blood remains as a reserve, is in the legs as a reserve blood, is also pushed towards the mainstream. So when you will push the blood from the legs towards the upper body, what will happen? The availability of the blood in the blood vessels will increase, the volume of blood will increase. That means in the vessels where the blood was not flowing initially, the blood may start flowing in those vessels with the new increased volume of the blood. So it is called opening up of the collateral blood circulation. To open up the collateral blood circulation, this ECP machine is used, and it is now used very widely all across India now. And to my understanding, it was last year when Australian government also allowed the installation of this machine in Australia. Now, the same effect can be derived with the help of the posture which we just demonstrated to you. So this asana, Viprit Karni, on the left side of the screen, when you keep your legs up on the chair, I have not shown this asana with the help of a bolster. I have just shown it the simpler way, the one you can easily do. And I also asked you to keep your body 1 foot away from the wall. Stay away from the wall. Don't try to touch your hips to the wall when you do this asana. So same effect you can derive when you do this asana on regular basis. You keep your legs up and the blood starts flowing from your legs towards the upper body. So the collateral circulation in the heart muscle also opens up. And one of the major complications of a diabetic is the cardiac complications. So this asana is very important to avoid the complications, but it is recommended to do these asanas gradually. Pick up this pace easily, slowly, gradually. So don't keep your legs directly high on the wall. Keep them only on 20 degrees on first day. See, you're not feeling any pressure in the head. See, you're not feeling any redness on the face. Your eyes are not getting heavier. So once you are comfortable with 20 degrees of legs on the wall, then you take it to 30 degrees, then you take it to 40 degrees, then you take it to 50 degrees, then gradually increase the angle. Don't reach to 80 degrees on day one. So what I said in the very beginning, listen and respond to the signals of your body. If your body says 20 degrees is what I enjoy, do only 20 degrees. If you take it 40 degrees and your body is not happy with that pose, your body is giving you some signals like heaviness in the head, redness of the eyes, or uncomfortable feeling, don't do it. So any asana that gives you uncomfortable feeling, don't do it. And the best thing is, and the strongly recommended part is, do it only with a yoga teacher. Do it only with somebody who knows how to, get the corrections done. So you can do it with your yoga teacher. All right. So this ECP machine is a widely used machine now. You can reap the benefits of this machine by simply doing this asana for 10 minutes every day. It helps you for relaxation. It helps you to sleep better. It helps in cardiac conditions, improves venous drainage, so removes swelling from the legs. All right. So moving ahead with the subject, and the time is also very limited. So I'll not touch upon some of the other topics which I thought if I'll have time, I'll touch them. But we can probably keep some time for other important topics which are relevant to everyone, not only for those who have diabetes problem, but to everyone. For example, diabetes, for example, using treadmills, for example, walking on a correct surface, for example, driving an automatic car or a manual car, which one is better, how you can simply do some corrections in your posture and avoid neck pain, knee pain, slip disc, sciatica and a lot of other things. What is the correct posture? Which game you should choose? All these things we can talk in sometime in the future. Which games you should choose, what is the correct posture, and all of that. What is the correct sitting posture? All right. So now I'll bring your focus to the third chapter of this webinar, which are thoughts. So third part is the thoughts. Now, to control diabetes, it is important for you to stay relaxed, easy, carefree, not careless, carefree. He said this thing to me. Oh, that fellow is, he bothers me a lot. He does backbiting. Or take things easy. Let go. Forgive people and stay relaxed. The more relaxed you will be, more your parasympathetic nervous system will be activated. And if the parasympathetic nervous system works efficiently, the sugar levels drop. They drop quickly and they stay within normal range for very long time. So relaxation is integral to control diabetes. Do short meditations daily in the office. I'm going to share a quick meditation audio with you now in the group. So you can follow this meditation in the office. It's a quick 5-minute relaxation technique. So once you are done with your lunch, just put the earphones in your ears and sit back. Do this meditation for 5 minutes. This will relax you in the mid of the day. And then when you come back home, when you're going to the bed, then again do another relaxation, which again I'll share with you in an audio format. Put it in the mobile phone and do that meditation while going to the bed at night. Now, these are the two things which you can easily do. Staying relaxed is definitely not difficult, it's easy. Now, to stay relaxed, the third point is avoid those people and situations that cause stress. You know that you are a hardcore BJP supporter, you are a hardcore Modi fan, and you meet somebody who is anti-Modi. Can you avoid this situation by not triggering that argument on whether Modi is doing good or whether he is not doing good? You can avoid that argument. You stay relaxed. Neither that fellow is going to get convinced, nor he'll become a Modi Bhakt. It will only increase your sugar levels if you will start debating on something that causes stress. Same applies to any debate. Means whether it is the condition of miners in Australia, miners means the coal mining and the iron ore mining and their condition, or whether it is the pact between the UAE and Israel, it does not affect your life. Means you can still stay out of it. You may know what is going on in the world and still stay unaffected from it. That is what the philosophy of Lotus is. That is what the philosophy of Om Purnamada Purnamidam is. That is what the Indian core values are. Why Lotus is the national flower of our country? Because Lotus denotes the philosophy of Vedas. The Lotus denotes the philosophy of Bhagavad Gita by staying in water and still not getting wet. Even if there is a drop of water on the leaf, on the petal of lotus flower, it still doesn't get wet. It shows you non-attachment. It shows you that you are surrounded with a lot of mud and still you're not affected. You're still relaxed. You're still on the top of your beauty. That is why lotus is given so much importance in spirituality and especially in Indian culture. What are the ultimately takeaways of the session that we have done today? The first and the foremost thing is to listen and respond to the signals of your body. If you will listen and respond, I said, listen and respond. It's not only about listening, it's not only about responding. Listening and responding to the signals of your body keeps almost all the problems out from your body. And the 3 legs for diabetes. And I would rather say not only for diabetes, three pillars of health: Aahar, 𝗵𝗴, and vichar. So diet, activities, and thoughts. You must check all the 3 doors. If any of the 3 doors is left open, the problems can definitely set in. So for diet, you have to follow the correct time and quality of diet. We have already discussed in detail. Correct activities involves 10 minutes of yoga practice, the 2 postures that we have discussed. Full sleep is definitely a must. Correct thoughts. Now, correct thoughts means staying relaxed. That leads to correct thoughts. I'll not say stay positive, always think good, don't think negative, don't get stressed. Keep all that gyan to a side. Do one thing. Stay relaxed. If you stay relaxed, positive thoughts will automatically start flowing in. Negativity will automatically start flowing out. Your job is to stay relaxed. Stay relaxed. And the third thing, practice, and practice. Do you think I've given all this gyan to you today and you'll start doing it from today? Everything is going to be on the track from tomorrow morning, and you will have a green vegetable juice in the morning, and then you will have your lunch, breakfast, dinner, everything on time, and you'll be doing yoga postures every day from tomorrow morning. It will take practice, it will take time, it will take consistent effort. Satu 𝗕𝗃𝗃𝗃 nairantarya satkara sevitro dridhabhumi. Continuous, uninterrupted yoga practice is what you have to follow. And the first thing, the first slide was, who is a yogi? What do you want to achieve? Focus. Focus on controlling diabetes. Focus on good health. And all of these things will start doing automatically. So, become a yogi. So do not become a yogi of asanas only. No. Become a yogi. Become focused on what you want to do. What you want to achieve. Get focused on that. What do you want to achieve? You want to achieve controlled levels of blood sugar. You want to achieve excellent health. So get focused there. If you're focused there, things will start flowing in. So wherever you will focus, it will start growing. So is it start happening from tomorrow? Yes, some part of it will start happening from tomorrow. Some will happen from day after tomorrow. And then gradually when you start practicing it, it will become a part of you. So healthy habits should become a part of you. So practice, and practice. So these are the things that I wanted to share with you. You can invite, we are happy to do these webinars, seminars on different health topics, like the treatments that we do in the medical yoga sessions are lower back pain, shoulder pain, knee pain, neck pain, frozen shoulder, arthritis, diabetes, high and low blood pressure, thyroidism, menstrual disorders, stress. All of these things we give online sessions for, and we also do seminars and webinars to make public aware on all these things and help them to get out of these things. So you can get in touch with us on the numbers which are displayed on the screen here. And we are more than happy to help you. If you have any of your personal questions, we can take some of the questions now. Or if you want to book in a one-on-one session, that's you can go on medicalyoga.in and book some sessions there. And now we can take some questions from the audience if there are any. Yes, Vidyaji, thank you very much for sharing the email ID. That is info@medicalyoga.in. You can send your queries on this email, info@medicalyoga.in.
Thank you so much, Doctor. We don't have many questions. There's a few questions here. I know Siraj has posted them above as well. So the first question there is, doctors say that diabetes is a cardiovascular disease. So can people with blood pressure do the second asana, the 𝗵𝗡 karni?
Yes, they can do this asana. It is actually a posture which is a part of high blood pressure treatment sequence. So it is a very good posture for high blood pressure patients. For those who have high blood pressure, they must keep a pillow, a thin cushion under their neck and head, as we demonstrated in the posture at that time. And you should start doing the practice of this asana from 20 degrees. From 20, take it to 30, then 40, then 50, then gradually increase it. And keep monitoring your blood pressure readings, and you'll actually find a lot of difference in your in your BP readings, because that asana also relaxes your mind, and BP goes up if you're stressed. So that asana relaxes your mind and hence brings down the blood pressure. That asana, the 𝗵𝗡 karni asana that we have shown, it also improves venous blood circulation from legs towards the heart. So the blood easily floats towards the cardiac muscle, hence the blood pressure comes down. The pressure on the cardiac muscle reduces, which leads to correction in the high blood pressure readings. So this asana is definitely good for high blood pressure patients. It is definitely good for cardiac patients. And when I talk about cardiac conditions, I'm talking about general cardiac conditions.
And in terms of how long is that second? Sorry, the voice is a bit cut off during the asana. Is it 10 minutes? Or
10 to 15 minutes is the good time to do that asana. 10 minutes is the minimum time that I want you to do that asana for, and you can do it up to 15 minutes.
Wonderful. Two other questions here. So can hypertensives do the first asana of twisting the torso?
Yes, they can do that asana.
And the second
one very important thing, okay, so those who have hypertension and those who do not have hypertension, it applies to everyone. When you're doing a twisting asana and you hold your breath, you forget to breathe normally for a minute. Even those who do not have hypertension, you actually tighten the body and stop breathing, increases the blood pressure. So follow the instructions which are given during the session properly. So breathe normally when you are in the posture. Breathe normally. Do not hold the breath. If you'll hold the breath, the BP may go up. So breathe normally when you're doing the twisting pose or you're doing any other yoga pose. So the instructions of breathing are given when you're going into the asana and you're coming out of the asana. At that time, going in and coming out, you have to follow breathing in, breathing out, as it is said by the expert who is leading the session. But when you're in the posture, when you're maintaining the posture, breathe even, breathe normally. Don't hold the breath. If you'll hold it, the BP may go up because body needs oxygen. To circulate that oxygen, heart will start pushing more blood. That will increase the blood pressure. So if you'll breathe normally, if you'll provide sufficient oxygen supply to the body, the BP will not go up, it will stay normal, and with the help of the asanas, it will start coming down as well. Yes, please. Thank you. Next question.
And Priya has a question to say, can you suggest any fruit or vegetables to boost metabolism, which helps in reducing blood sugar?
See, this fruit, you must eat local seasonal fruit. That is one thing. When I talk about local, I am talking about the region you belong to, region you're born and brought up in. That is the local fruit for you, actually. And then when you migrate to another place, then that place is also local for you, but it should be consumed only 30%. 70% local fruit is still the place where you are born and brought up, right? So you must eat seasonal local fruit. That is one thing. Even if that fruit is, is a little sweet, is a little extra sweet, still have that local seasonal fruit. It is recommended to have that. You can cut down on your sugar consumption somewhere else. Have tea without sugar. Have have some other shake, or you can skip the shake, or you can skip some other thing that you take sweet during the day, but you must eat local seasonal fruit. That is one thing. Second thing is to boost metabolism. See, metabolism, to boost the metabolism, you have to give surprise to the body. If you will give a surprise to the body, the metabolism goes up. Now, if you start taking if you don't take vegetable juice, if you start taking it from tomorrow, your metabolism, goes over the roof. It boosts like anything. And then you have to give another surprise to the body, let's say after 10 days. Change the recipe of the vegetable juice. So you're still eating healthy, and you have given a surprise to the liver. So giving surprise increases the metabolism. That is the easiest way to boost metabolism, right? So you can change the recipe of vegetable juice. That is one thing. One recipe, second recipe, third recipe, fourth recipe, one recipe. In any ways, I'm going to share rest of the recipes. You can, you can find online and start following them. That is a quick metabolism booster. Second thing is exercise, for sure. Start doing some exercises which involves the torso of the body, chest and abdomen. So that will help you to boost your metabolism. And when it comes to a particular fruit or a particular vegetable, I would rather say low glycemic index fruits are good for general consumption. You can take papaya, you can take jamun, you can take some other berries which are not that sweet. So those things are okay to consume in routine lifestyle, but still give a boost by giving a surprise to the digestive system. Right.
Those seem to be all the questions here, Doctor. So from my end, thank you so much for this session. I found it really, enlightening. So thank you very, very much.